Hello viewers, welcome to HCC Coding channel. In previous video, we have discussed what is medical record, what it includes, how many types of formats we will be having in medical record, and the types of signatures, date of a visit, everything we have covered. Today, we will cover Introduction to ICD-10-CM. What is ICD-10-CM? We'll see that, and what are the updates we usually get in ICD-10-CM, and what it contains, and how many chapters it includes. We will see. Yes. First thing, what is ICD-10-CM? Yes, before going to an abbreviation, I'll be telling you a small story about this ICD-10-CM. It is a manual. It is ICD-10-CM is a manual which is particularly used in the HCC coding. Okay, this is about ICD-10-CM where it includes different types of codes. Where it includes different types of codes in this particular manual, and completely it belongs to HCC coding. And coming to the abbreviation, International Classification of Diseases 10th Revision Clinical Modification is the abbreviation for ICD-10-CM. And coming to the definition part, yes, this is a manual which includes the codes and which will be used by a healthcare providers or medical coders or health insurances, which includes the diagnosis or symptoms or conditions or diseases related codes it contains. And who will be developing this, or who have designed this particular ICD-10-CM? It was developed by Centers for Disease Control and Prevention and the National Center for Health Statistics, which is covered under WHO organization, the World Health Organization it was. And updates. Usually, this manual is not permanent. Like whatever, once if we are getting the manual is that is not permanent. Every year, every year this particular ICD-10-CM manual will be updated, particularly on a date called October 1st. Every year, October 1st, this ICD-10-CM manual will be updated. Updated means what? What update it will be getting means complete book will not be changed. Any codes need to be changed. It will be changed, or like modified. Any codes to be modified, it will be modified, or anything need to be deleted, it will be deleted, or any new added codes or newly designed codes can be added in this particular ICD-10-CM, which includes different types of diagnosis coding or emerging diseases codes. What ICD-10-CM contains means usually what it contains. It includes a different types of codes. It includes a different types of codes which might be only about the diseases or injuries or symptoms or external cause of injuries, or like symptoms like cold, flu, fever. All these codes also you can find in this particular ICD-10-CM. In ICD-10-CM, we will be having two volumes. Volume 1, we will be calling it as a tabular list, and volume 2, we will be calling it as a alphabetical index. And how many chapters it includes? Yes, each and every manual or each and every book, it contains a chapters, right? The same way, ICD-10-CM also contains 21 chapters. Each and every chapter will be designed based on the different types of conditions or diseases or injuries or other health conditions systematically. We'll see the chapters one by one. What are those 21 chapters? We'll see one by one. Coming to the first chapter name is certain infectious and parasitic disease, which starts a code from A00 to B99 category codes. It includes, this particular chapter includes A00 to B99 category codes. All these A00 to B99 category codes all will be related to infectious conditions like a type of pneumonia, tuberculosis, HIV, AIDS, or any parasitic diseases that comes under chapter 1. And coming to chapter 2, neoplasms, where it includes a C002 to D49 category codes, where it includes a different types of a neoplasm. We will be having different types of neoplasm, like tumors. We will be having benign neoplasm. We will be having malignant neoplasm, carcinoma in situ neoplasm, and unspecified behavior, uncertain behavior. Like different types of neoplasms will be covered under chapter 2. Chapter 3, where it includes disease of the blood and blood forming organs, where it includes the code ranges from D50 to D89 category, which includes a completely anemia or clotting disorders or hemophilia, leukemia, like all completely blood related disorders comes under chapter 3. Coming to chapter 4, the chapter 4 name is Endocrine and Nutritional and Metabolic Diseases, where the code category starts from E00 to E89 category, where it contains different endocrine gland disorders like a type of diabetes, obesity, malnutrition, thyroid disorders, and other metabolic conditions. Coming to chapter 5, the header of chapter 5 is mental, behavioral, and neurodevelopment disorders, where it includes F01 to F99 category codes. Chapter 5 completely includes a different mental disorders like depression, bipolar disorders, anxiety disorders, schizophrenia. All these mental behaviors or intellectual disabilities will be covered under chapter 5. And coming to chapter 6, diseases of nervous system, where the codes includes a G00 to G99 category. Like all neurological disorders comes under chapter 6, like epilepsy, seizures, Alzheimer's disease, Parkinson disease, and multiple sclerosis. Coming to chapter 7, diseases of the eye and adnexa, where the course starts from H00 category to H59 category. This chapter 7 completely related to eye related disorders like cataract, glaucoma, conjunctivitis. All complete retinal disorders will covered under chapter 7. And coming to chapter 8, this is of ear and mastoid process, where the course includes from H60 category to H95 category, where all related ear disorders will be covered under chapter 8. Ear infections, hearing loss, vertigo, all different types of ear disorders will be covered under chapter 8. And coming to chapter 9, disease of the circulatory system, which includes the codes from I00 category to I99 category. This particular chapter includes a major diseases like a heart diseases, that might be coronary heart disease, or that might be heart failures or hypertension, stroke, or other vascular conditions. All different types of circulatory disorders covers under chapter 9. And coming to chapter 10, this is of the respiratory system, where the code starts from J00 category to J99 category. It includes respiratory diseases such as pneumonia, asthma, chronic obstructive pulmonary disease, and bronchitis. Different types of respiratory disorders covers under chapter 10, disease of respiratory system. And coming to chapter 11, this is of digestive system, where the code category starts from K00 to K95, which covers all digestive system disorders, that might be gastrointestinal diseases, liver disorders, and conditions affecting the pancreas and the gallbladder. Coming to chapter 12, this is of skin and subcutaneous tissue, which covers a course from L00 category to L99 category. Completely, this chapter 12 includes skin related disorders or skin related conditions like dermatitis, psoriasis, or any infections in your skin. All those disorders will be included under chapter 12. Coming to chapter 13, which is nothing but disease of musculoskeletal system and connective tissue, where a code category starts from M00 to M99, where it covers all musculoskeletal conditions such as arthritis, back pain, osteoarthritis, osteoporosis, and all connective tissue disorders will cover under chapter 13. And coming to chapter 14, disease of the genitourinary system, The code category starts from N00 to N99 category. It includes different types of kidney disorders. That might be the chronic kidney disease, acute kidney disease, urinary tract infections, bladder disorders, or sometimes it affects the reproductive organs also. All this covers under chapter 14. Coming to chapter 14, chapter 15, pregnancy, childbirth and puerperium, where the code category starts from 000 to 099 category codes, which covers from starting of the pregnancy to till delivery, what complications the patient used to have, what complications a pregnant patient used to have, and what are the surgeries she will be going on, like vaginal deliveries or cesarean deliveries. In that cesarean deliveries or in that vaginal delivery, what complications a mother will be facing and what type of deliveries we will be having, everything will cover under chapter 15. And coming to chapter 16, certain conditions originating in the perinatal period, like the code starts from P00 to P96 category, which is completely related to newborn codes. Newborn codes, starting of the newborn baby means delivery of the newborn baby, like what conditions or what baby is facing, what complications the baby is facing, every disorder or every complication will be covered under chapter 16. And coming to chapter 17, congenital malformations, deformations, and chromosomal abnormalities, the code starts from Q00 to Q99 category, which is completely related to by birth disorders, birth episode disorders. By birth, if the baby is uh, facing any complication or any disorder, all those diseases comes under chapter 17. That might be any congenital malformations or chromosomal abnormalities, everything will cover under chapter 17. And coming to chapter 18, where it includes completely symptoms, signs, and abnormal clinical and laboratory findings or laboratory finding codes, where the code category starts from R00 to R99, which includes symptoms like a fever, pain, and abnormal lab results, and other non-specific signs of diseases, means different diseases, signs and symptoms will be comes or covered under chapter 18. All R category codes, usually it will be completely belong to the signs and symptoms of different types of diseases. And coming to chapter 19, injury, poisoning, and certain other consequences of external causes. The code category starts from S00 to T88 category, which covers the different types of injuries. That might be the fractures, or that might be any poisoning or adverse effect due to usage of any medication. If the patient is facing any complication, everything will be covered under chapter 19. Coming to chapter 20, external causes of morbidity, where the code category starts from V00 to Y99. It includes all external causes of injuries such as motor vehicle accidents, falls, and environmental factors like weather-related injuries. Like that might be due to cyclone if anyone is facing any injuries, or due to earthquake anyone is facing any injuries, or due to motorbike accidents, or due to any car accidents. That might be any type of accidents due to any external causes. If the patient is getting any injury, that all injuries will covered under chapter 20. And coming to chapter 21, factors influencing health status and contact with health services, which includes a category of codes from Z00 to Z99, where this chapter 21 consists of different family history of diseases and encounter codes and health services or vaccination related codes. Everything will cover under chapter 21. All these are the list of chapters, and what the chapter names, what it includes, what type of diseases it includes, everything we have seen. And we'll have a small definition, like a brief about ICD-10-CM, where each chapter in ICD-10-CM system covers a broad category of health conditions within each chapter. The code becomes progressively more specific to allow for precise classification and coding of a patient diagnosis. Means in each and every chapter, we will not have only the condition related codes. The condition specifications, if the condition is having any specification related to that. For example, if I am mentioning a bronchitis is a condition, and if I am mentioning it has a acute bronchitis, acute is a specification of a bronchitis. So each and every chapter will consist of the condition, and condition specifications also will be covered in this particular ICD-10-CM. This is about the introduction of ICD-10-CM. Yes, thank you. For more interesting videos, please like, share, subscribe to our HCC Medical Coding channel. Thank you.